So the dental program here is very much a family, and when they first come in, they're always very nervous, and they, don't want to talk as much or ask questions, and by the end of it, we can't get them to stop.
We are a close-knit family. We don't consider ourselves just a team, but we look at ourselves as a family. And the students see that and they feel that energy. I try to make sure I build a relationship with the community. I was in the field. I know exactly what the doctors are looking for, and we gear our teaching towards that. And then we have the no quit attitude. You fall 7 times, get up 8.
I spend the first day of every class always asking my students what they need. I essentially work for them. 9 times out of 10, the entire class screams hands-on. They want to touch, they want to do, they want to practice as much as possible. And this school specifically is really good at allowing that to happen. We do have lecture classes, obviously, and even in the lecture classes, we bring in as much hands-on as possible to get them what they really need and for their specific learning style. There's a lot to know about the teeth. What you call a molar is what I call a wisdom tooth, or bicuspid or premolar. So we really try to give them every option that tooth would really be called in the field, from anyone from a patient to a doctor to a colleague. And then we build upon that. So every semester we will continue to go over the anatomy of the teeth, the terminology they're going to learn, and then we build upon that again and review it again. So by the time they leave, it's second nature.